everyone, this is Doctor in the House right here on Channel One TV. My name is Chris Carter, and I always like to remind you that this is the show that acts like the consultation before the main consultation. And also, if you have any questions concerning the discussion that we're going to be having, what we do is open the WhatsApp lines for you to be part of this show by sending in your questions, and we will get to answer it right here. And I'm sure you're wondering who's the doctor in the house, but before I give you that information of who the doctor in the house is, we're going to be talking about breast cancer because we're still in October, and October is Breast Cancer Awareness Month. In the first week of October, we had a little discussion about it, and today we are going to be having another discussion about it. And in Ghana, actually, breast cancer is one of the leading causes of cancer-related deaths in women. And that's why it's important for us to have this conversation. So the doctor in the house is Dr. Wisdom Effiong from the Bank Hospital. Hi, Doc. It's nice to have you again.
Thank you. Good to see you.
Yeah, and you see, you're all doctor today. Yeah, I can tell you're coming in from the hospital right to the studio, and yeah, but it's nice to have you.
Yeah.
So last time we had some conversations about breast cancer. We didn't quite finish the whole conversation because we could actually go on and on and on when it comes to the issue of breast cancer. And we also know that 1 in 6 women, right? 1 in 6 women can actually have breast cancer, so it's a very important conversation to have. But now, in the world, or let's say in Africa, or in our world, that's Africa, in our society, there are a lot of myths surrounding breast cancer. What are some of these myths, and how can you actually break out these myths into what the real facts are? Yeah,
I think before I go into that, thank you once again for having me. I think that, like you said, there are a lot of myths surrounding breast cancer, and hope that we're able to debunk some of these myths. And, you know, when you mentioned Africa, what came to mind was spirituality. Yeah, because we're very spiritual people, you see. So when people think that they have breast cancer, you know, they want to go all out spiritual, right? I'm a spiritual person, and I'm equally a doctor, so I don't neglect the fact that, you know, God, there is God, and who can solve all things. But the fact that God said that we should honor our bodies in 1 Corinthians, it means that you could also, you know, Luke was a doctor, you know. So Luke was a doctor? Yes, Dr. Luke. Luke in the Bible was a doctor, right? You know, so the Bible is double-edged. What that means is that as we fight things spiritually, we could also seek medical intervention, right? So that balances everything out, right? So one of the myths is that it is spiritual and it would go spiritually. Right, that's one thing that, because it came spiritually, it has to go spiritually. For some people, that works. But what I'm pleading with the people is that don't neglect medical therapy, medical care, right? And I just wanted to send that out for everybody to know that. Another myth is that every lump is a cancer. That is not true. And, you know, that's what forms the stigma. So people do self-breast exam every month, and they find a lump. And because they assume it's cancer, they don't want to go seek medical attention. And I think that is wrong, because it could just be a fibroadenoma, because there are so many things to take into consideration. You know, in as much as it is hard to take out a cancer, it is equally hard to get cancer. People don't know that, you know. You know, people say that when you write an exam, it's hard to pass. Yes. It's also hard to fail. You know, for you to fail an exam, it means you didn't do nothing in that paper, right? So not every lump is a cancer. So when you find one, someone called me a few days ago that, you know, she's having this lump in her breast. She's had it, you know, about 2 years ago, and then all of a sudden it vanished. But, you know, hearing me talk about breast cancer, she did a self-exam, and then she noticed that she's having this lump again. It's back again. And she's scared. She doesn't know what to do. You know, and this is a young adult, no family history. So I was like, you know what, just get an ultrasound, you know, just to be on the clear. And if it is fibroadenoma, if you want us to take it out, that will be taken out. Otherwise, you could also let it be there, you know. So another myth is every lump is a breast cancer. That is not true, you know. So I don't know what other myths people have in there, but I know that people also think... and deodorants. People... that it causes cancer? Yes. No? Tell us about that one, because that one is a very, very
serious conversation that is like, it's always up for discussion when it comes to the issue of health. You know, oh, like this antiperspirants, deodorants, you know, you have like nodes here, and when you spray it, it's going to cause you cancer. Please let us know. Does it cause cancer? So we know what we are doing with our lives.
So, like I said, cancer can be sporadic. You know, the last time I mentioned some of the risk factors that we have. We mentioned a family history. We mentioned a mutation in your genes, BRCA1, BRCA2 gene. You know, we mentioned social lifestyle, smoking, alcohol, not exercising. Yeah, we mentioned all these things. You know, we did not clear-cut point out that this causes cancer. Now, what we know is that they are risk factors, right? Now, when you are exposed to, you know, certain carcinogens, you know, like things that could cause mutation in your gene, you know, i.e. sometimes sunlight. You know, people exposed to sunlight can be predisposed to skin cancer. So you see, so that does not necessarily mean that sunlight equals skin cancer, right? But the fact that maybe you have some genetic, you know, epigenetic modification that would predispose you to, and now you have exposed yourself to it, that could cause cancer. The same way, deodorants would not directly cause cancer, right? Maybe you might experience some symptoms that might cause you to go to the hospital, and then we incidentally find out that you have cancer. That does not mean that it directly causes cancer, right?
So, and the issue of larger breasts and smaller breasts, that's another myth. Listen, you know, some people said, I think people with larger breasts are more susceptible to cancer than smaller breasts. So let us know, is that true?
Do men have large breasts?
Oh, okay.
That's the question I'm asking.
No.
Do men also get breast cancer?
Like the big men have
not
breasts.
in this studio, at least. I think I've done a scan of this. I don't think. Right. So the fact that people say or people think that people with larger breasts tend to have cancer as compared to I don't think that is true. You know, because the breast is the breast. The tissue is the tissue. Those who have smaller breasts get pregnant, their breast enlarge. So it doesn't mean that, you know, you are now. Meanwhile, we mentioned that pregnancy and breastfeeding is a good. It helps you prevent. Do you understand? So that is a myth. People actually also think that wearing tight bras.
Yes, I'm going to talk about the bra. Does the bras actually have anything to do with it?
It wouldn't cause cancer, but it could cause other things like mastitis, you know, breast pain, cause you to have even there are some times that, you know, certain conditions that we might actually prescribe tight bras. You know, there are certain times I would say, okay, for now, use tight bras.
Really?
What
kind of
you know, so it does not necessarily mean that it would, you know, cause, you know, breast cancer. It wouldn't. Yeah, and some people also think that the fact that I don't have a lump means that I don't have cancer.
Yeah, actually, the last year we had a survivor join us on set.
Okay.
She didn't have a lump. It was not visible.
Yeah. But she had cancer.
At some point, the only thing she saw was a tiny pimple, like a tiny sore on the nipple, but there was no lump.
No lump at all,
but after everything, it turned out that she was in stage 4.
Wow. Wow.
After everything, there was nothing was showing.
Wow.
No lump, no nothing.
Wow.
She had to go to the hospital because the sore wasn't healing.
So that's a message. That's a message.
That just means that we need to always go to the hospital. But what are some of the
self-breast exam? Perhaps if she hadn't noticed.
If she hadn't known that, oh look, I don't have a pimple before, now I have a pimple.
Yeah, if she hadn't noticed that, she wouldn't have.
So how important is it for us to know our breast?
The last time I mentioned that every month, that's how important you should know your breast. Every month. Because if you don't know the normal, Chris, how would you know the abnormal? You know, it's just like listening to heart sounds. You know, there are certain things.
So if you don't know the normal, how will you know the abnormal?
The abnormal.
So you have to be friends with your breast.
Exactly.
Basically.
Every month it should be your bestie. You know, for the females, I mentioned that at least 3 to 5 days after your menses. You know, that's where the glands are out and all that. So you are able to feel when you feel that you know that these things. The last time I mentioned these lobules. You know, you're able to feel them. You know, okay, this one was not there before my menses. It was there after my menses. So maybe if you notice that this lump persists.
Yeah.
Even after my menses, 1 month, 2 months, I'm still feeling this lump that I'm feeling.
Right.
Then that calls for,
Right,
alarm.
right.
And then for those who don't also feel a lump, I mentioned that if you have a family history of breast cancer, let's say perhaps you have a parent who died at 40 years. Now, what that means that half the age of your parent, that is the time that you should start getting it.
Half the age of your parents.
Yeah, at the time the
Yeah.
person dies. So if the person died at 40, it means that when you are 20, you have to start getting screened.
So when you're
Right.
20, you should start getting screened.
Screened. You know, 'cause-
Okay, so if you're listening now, I think I want the doctor to actually repeat this part again, especially for people who have a history of cancer in their family. So I think you should say this. It's actually very important.
So what I'm saying is that if you have a parent or, a direct relative who perhaps, most of the time we use parent, because the breast cancer gene is what we call, it comes down in every generation.
Yeah. So it's in every generation, you must find one
exactly,
person.
every generation. It's a likelihood, that it would occur. So if perhaps, unfortunately, you lost your parents and the age at which your parents died, let's take, for instance, 40. What that means is that every of your sibling, including yourself, when you are 20, you should get screened. Even if you don't have symptoms, even if you don't have a lump, even if you don't have a sore, even if you don't have nipple changes, at least you should get genetic screening, and let them identify, is this something that is possible? And if you know Angelina Jolie, do you know Angelina Jolie? Yeah, she actually was tested of, the BRCA gene positive, and she had a bilateral total mastectomy, and then she's still there till now.
All right, so let's talk about treatment.
Yeah.
What treatment options do we have in Ghana when it comes to breast cancer?
So it depends on the particular stage that we find that this is breast cancer, and I mentioned that we have to find out what exactly, is it a ductal carcinoma, is it a lobar carcinoma? We want to name it, right? Now, when we name it, the next thing we do is to stage it. Is it in the first stage, second stage, third stage, Has it spread? Is there a local spread? Is there a distant spread? So that's what informs treatment. It's not that everybody with cancer gets this particular treatment.
Yeah, mastectomy.
It's
chemo,
patient.
this, that.
It's patient-based, And then we also look at your age as well. Do you still have fertility wishes? Do you not have fertility wishes? Would explain all these things to you. Would you weigh the benefits over the risk? Right. Then when we decide that, okay, based on your age, based on your stage,
and fertility wishes,
and we want to decide that, okay, for this we'll do surgery. Now, what type of surgery? There's what we call local excision if it hasn't spread that much. So they'll just take out, where the lump is and then a few surrounding tissues, right? That is if the cancer hadn't spread, right? For those who spread through that particular breast, we'll do what we call a total mastectomy. So we'll take out that breast and even go further to do what we call axillary lymph node dissection. So because when it's spread, the lymph nodes are able to suckle some of these cancer cells.
And it can really...
so we go in there and take out, some of these lymph nodes. For some people, it has to be bilateral because both breasts have been affected, And even before that, like I said, depending on the stage, we might want to do what we call chemotherapy, before. Neoadjuvant chemotherapy is a chemotherapy before to help downstage it if you are in a higher stage, to help downstage.
So that's what it does.
Before the surgery. So it helps to shrink it. Then we do the surgery, take it out. Then you continue with chemo afterwards, right? Adjuvant chemotherapy. And then for some people too, they could prescribe radiotherapy. Which is more targeted to, the particular lesion, and that deals with it. And now when we also know the name of the particular cancer, there are other tests that we do, what we call the ER, we want to test it against other hormones. I mentioned that, because you're exposed to so much hormones, these cancer cells feed on these hormones, right? So there are certain times we do what we call, you'd hear breast cancer ER positive, PR positive, HER2 positive or negative and all that. So we want to find out, is it sensitive to these particular hormones? And can we use targeted therapy? There are certain medications that target the binding site of these hormones, right? So instead of the hormones binding, these medications bind and reduce the cancer cells. So that's what we call hormonal therapy. So in essence, or in a nutshell, we have surgery, we have chemotherapy, we have radiotherapy, we have hormonal therapy.
Right.
So these are the modalities of treatment when it comes to management of breast cancer.
And how is the recovery like?
It depends from individual to an individual. It's just like recovering from a stroke.
Right. Some recover faster.
Exactly. And the last time I mentioned that it could be likened to learning a new language, say Spanish.
Yeah.
How long would it take you to learn Spanish? It might take someone else 2 weeks, 2 months. It might take someone else 1 whole year. So it could be likened to learning a new language. So it depends on the patient's response and then the fact that we are targeting the right thing. And we have actually, some people, if you go for, let's say, a breast conservative surgery, let's say you don't want to take out the whole breast, and then you take out just a bit of it, and maybe you don't take out most of the cancer cells in the periphery, it could reoccur. Right, so sometimes we give you the option of taking out everything, but people like to conserve their breast, and so they wouldn't want that. That being said,
people have relationships.
But that being said, people could go for breast reconstructive surgeries.
Yes,
that is also possible.
Right.
And then that would.
All right. So we have 2 questions here from our viewers. The first one is it normal to feel pain in the breast?
Is it normal?
Yes.
It's not normal to feel pain anywhere in your body. Nobody likes pain. You know. Now, when you come to the hospital, we'll try to grade your pain over 10. It's a pain score. And we want to know how bad is this pain. I always joke around and I say that it's only 2 things that will take men to the hospital. 1, pain. Can you guess the second one?
I don't know.
If they are not able to perform sexually, erectile dysfunction. So unfortunately for some men, let me not generalize that now. So those are the only 2 things for some men. Because if they don't feel pain, they would not go.
Right, they will never go actually.
So men don't cry, right? And then if they cannot perform sexually, they will not go. But I think that any pain at all is not good for you. And pain management is a huge thing. And once you feel pain in your breast, please go to the hospital.
Right.
It could range from being just a mastitis, breast in the breast pain, or it could be an abscess, a breast abscess. So they are pus forming and collecting within your breast.
What about the hormonal feelings? Like, let's say when it's time for your period, sometimes the breast gets very sensitive. Would you classify that as pain?
I'm glad you mentioned sensitive, not pain.
So would you,
right.
So how would you know that this is sensitivity from hormones?
Great. So if it's from the hormones, most likely it would be bilateral. It will be both left and right. And the feeling will be the same. But when you have one particular feeling in one particular breast, then that's a cause for alarm, because you have 2 breasts, right? So if it's a hormonal thing, it will be all through the body, so it will be both left and right, and you are feeling the same way. And you have noticed that this is because of your menses, which means that after the menses,
is the pain is there?
If it's still there, then you should want to visit the health facility to get some labs done.
Right. Okay, so it's, please, now this question is complicated. They said, the situation where the breast suddenly becomes big in any way, is it linked to breast cancer? Out of nowhere, it just becomes big.
Yes and no. Where do I start from? Yes or no? Choose.
Start from no.
Okay, no, because, like I said, one could have, other inflammatory conditions like a breast abscess, that could cause the breast to be inflamed, reddened, swollen, and all that. Warm. When you touch it, it's warm to touch compared to the other breast. So that could happen and cause one breast, like I mentioned, to be enlarged more than the other. Now, that is the fact that no, it is not breast cancer. Another reason could be that perhaps you have a lump in there, or you have developed peau d'orange, like you said the last time. That would cause your breast to be bigger than the other, And some people, there are other type of cancers as well that causes, large breasts. Okay. So you want to get it checked. If one is becoming, like I mentioned the last time, almost every woman, your breasts are not the same.
Yes.
At least one is larger than the other, but it will be a little, larger, not grossly larger than the other. So the moment you notice that one is significantly larger, you want to err on the side of caution. Please go to the hospital.
Right.
Let's tell you that this is it.
Right.
And allay your fears.
All right. So there's another question, which is a very important question because I also grew up like seeing the same thing.
Okay.
Now, how normal is an inverted nipple? I grew up with it. I'm a mother now, but I'm always concerned about it. I mostly go for screening, but I'm concerned. Please advise me. Thank you. She was born with an inverted. I've seen people born with an inverted nipple. So now, but also inverted nipples can also be symptoms of breast cancer. So how normal is inverted nipples?
Okay, very good question. So the fact that you were born with it, like you said, not everybody is born with their heart.
Because
the
I actually really saw it. Like my sister is born with an inverted nipple, but now she has a baby. It's out. It's just there out like that.
Yeah. So there's a mechanism to which your nipple becomes inverted when it's relating to breast cancer, right?
Oh, okay.
Yeah. So and like I said, not everybody, is. That's why we treat a patient based on you. So if you always go examine every patient thinking that everybody's heart is at the left side, it's wrong because there are people who have their hearts at their right, and that's called dextrocardia.
Wow.
Yeah,
that's different.
People have all their intestines turned over to the other side. It's called situs inversus.
And they're normal. And they're normal.
They're normal people.
Wow.
So the fact that your heart is not on the left or your intestines have been turned the other way, situs inversus, doesn't mean you are abnormal, right? So you are just part of those 1%, of people who are that particular way, but you still function normally. So if she was born with an inverted nipple, and so like for instance, want to look at the other things, does she have a family history of cancer, does she have other signs and symptoms that she's experiencing? Now she's an adult and she knows about breast cancer. Has she gotten screened to ensure that, there's nothing wrong with it? Because it's easy to say, there's nothing wrong, but you don't want to do that until you have actually confirmed, right? And like I said, the mechanism to which in breast cancer you get a nipple inversion or tethering or puckering or dimpling is that these tumors within are growing and then they are pulling on the skin.
Oh.
They are pulling on the skin. You see how this is connected to the areola, connected to the nipple, right?
Yeah.
So when let's say the lobule is growing, it could be pulling.
It could be
on
pulling
the nipple.
on the nipple.
Yeah.
So that inverts.
That's inverts.
So it starts going back.
Exactly. So it means that it was not there before and you are now seeing it.
Because of the weight.
Exactly. So the bigger it goes, and for some of them, maybe just a small lump, and you might not see it pulling on it until you actually lift your hands, like we mentioned the last time.
Yeah.
And then that causes some tethering and just pulling on it. See? So yeah. So.
All right. We have another question.
Okay, let's go.
Please, I went for a breast screening and a lump was found, but the mammogram, from the mammogram.
Okay.
But the doctor said it wasn't cancer, that it was benign. I'm still not comfortable about it. What can I do, please? I understand this, but I'm still not comfortable about it.
Of course, if you've done the test and the doctor confirms that it is benign and you are not comfortable, the next best thing you could do because life is bio, psycho, social, spiritual. Now what that means is that's a module of life. Life is biological. In as much as it's biological, it's psychological. In as much as psychological, it is social. In as much as it's social, it is spiritual. So if you have this module at the back of your mind, you have to ensure that being a good doctor, you satisfy all these criteria when it comes to treating a patient. So if she does not feel comfortable, she could seek a second opinion. Perhaps do the scan somewhere else and see what someone else thinks. Maybe go far apart, maybe if she did it in Accra, she should go to Kumasi, You could do it 3 times. People do that with HIV testing as well, If you have done it here, you don't feel comfortable, you could do it somewhere else. So that could, allay your fears that, okay, actually it is benign. Now the next question is,
do I want to keep it or remove it?
Do you want to keep it or take it out? And you have that discussion with your doctor.
Right.
So
All
I think that
Doc,
she could do that.
Our time is up, but before I let you go, any final words concerning breast cancer to our viewers?
Yes, like I said, it's October, and all over Ghana and all over the world, people are taking advantage of this. If you have never done a self-breast exam before, I wish I could teach people how to do a self-breast exam, And
teach us now before you go.
I don't know if it's too. I don't
okay,
want to rush
next
through
week.
it.
Next week we'll do that.
We'll do that. So don't rush through it. Maybe we'll get someone.
Yeah.
So please get screened. please get screened. If you know a friend, if you are a man, you know your wife, your sister, just ask them to get screened. You know, just like cervical cancer. I'm sure we'll talk about cervical cancer some other time. You know, you want to get screened because you might not have any sign, you might not have any symptom.
There's never a sign.
You know, and for those who are Christians, I want to know that your body is a temple of the living God.
Yeah.
So what that means is that you've got to take care of your body, and one way to take care of your body is to get screened.
All right, Doc, I'm supposed to go now, but this is very important. Is it normal for a breastfeeding mother to be experiencing pain from time to time during the breastfeeding period?
From time to time, no, but most of the time, if the breast is engorged with milk and you don't let it out, you would feel pain, definitely.
All right, thank you, Dr. Wisdom Effiong.
Right.
Where can people reach you?
The Bank Hospital.
The Bank Hospital. All right, we have more questions coming, but yeah, I'll get to talk to you about it later or next week we'll read it. But yeah, thank you so much, Dr. Wisdom Effiong from the Bank Hospital. It's been a great conversation about breast cancer. And I think next week we might just continue this conversation because obviously I can see your questions coming in and it's important these questions are all answered. But thank you for sending in those questions and thank you for joining us. My name is Chris Carter and see you next week. Bye.